So again, just to reiterate, my name is Michelle and I am a neuroscience major at Ohio State University and I'm a fourth year.
My name is Lake Lamb. I'm also a fourth year at The Ohio State University studying international studies.
And we will be presenting our topic on psychedelic authenticity, which will be presenting an integrated therapeutic model that embodies a decentralized framework.
So, origins, ritual, and ceremonial use. Ritual practices exist in a multitude of ways, and they universally facilitate the physical connection to the energetic plane. Ritual practices require cultivating a relationship with the space you're in, which is inherently indigenous, a way of being that has transcended through generations.
So with that being said, in their 2014 work called Embodying Decolonization, Rittenberg and colleagues expressed this quote: "Embodied relationships, which are rooted in respect, reverence, reciprocity, and responsibility as ways of being grounded in interconnection. In all these activities, we are unlearning disconnection and disassociation while relearning connection. And embodying this idea of relationships is what is foundational to Indigenous wisdom and practice. It begins with cultivating a reverent relationship with the land, which directly translates to the relationships that we can build with one another. So, what's ritual?"
So, the idea of ritual is relative, but in its most simplest form, it is a reciprocal relationship and mutual respect of healing practices. As a botanist and citizen of the Potawatomi Nation, Robin Wall Kimmerer, author of Braiding Sweetgrass, is an advocate for expanding ecological consciousness through acknowledgement and reciprocity with the rest of the world. In her book, she countlessly remarks the idea that everything in nature is animate, even the most grandiose things, such as mountains, canyons, and forests. In practicing with the land, it is important to learn from the land and treat nature as a guide. Various regions will develop ancestral stories with respect to the generational evolution of their region in order to pass down the teachings of the land. So, where are we today?
Colonization. We can first begin by addressing the following questions. So, what is it? How has it been reflected in the psychedelic renaissance? And how do we approach psychedelic practice and research within a decentralized framework? First, what is it? Colonialism is not a historical event. It is a concept and it is a way of being that can evolve. Colonialism, therefore, is an institutional framework that has been present for thousands of years through the infliction of power matrices that are rooted in control. In relation to psychedelics, colonialism began with the suppression of ritualistic spiritual practices outside of Christianity. What this means is that various groups who utilize medicinal plants through ritual practices were demonized because they didn't uphold the dominant dogma of the time. This has been perpetuated throughout history with examples such as the 15th century evangelization of South America to the present day war on drugs, which spans from 1973 up to today.
So, how has this been reflected in the psychedelic renaissance? So we as a psychedelic community have a unique opportunity as we are coming out of the Prohibition era to discontinue coloniality by embodying our ancient roots. However, the present danger that we face is blindly carrying our colonial past into our modern psychedelic models. What this danger manifests as is claiming these medicinal practices that are inherently indigenous as Western medicinal progressivism. Colonization is so ingrained into our society that we fail to recognize when colonial tactics are being employed. For instance, Western therapeutic tradition practices restrictive therapy, meaning everything is controlled to avoid outside variables.
And a decentralized framework embraces variables because variability is inevitable outside of therapy. So, in this sense, there is a disconnect between Western therapeutics and nature, which is simultaneously variable and constant. So, the question that we pose: why does Western therapeutic practice and research avoid variables when variability is ultimately the constant? This question embodies the nature of neo-colonialism, which is control, whereas a decentralized framework embodies the nature of experiential fluidity.
Psychedelic therapy is at the crossroads between following in the footsteps of colonial progression and forging a new therapeutic path that models a decentralized framework. It is up to us as the emerging psychedelic community to choose the route that progresses psychedelics away from the colonial past into an accessible and unrestrained future.
So, how do we approach psychedelic practice and research within a decentralized framework? Well, we can first begin by interpreting this idea of decolonization. Decolonization is essentially the process of unlearning the dominant dogma of knowing and being and relearning an equitable ideology that's reflected in its pre colonial framework.
So, how can we remain authentic to the origin of psychedelics within a modern framework? It begins with recognizing that colonialism still is incredibly prevalent in many aspects of our society today. This includes the psychedelic community. Within this recognition, we can then progress by cultivating a reciprocal relationship with the land, the medicine, and each other. From this point, we are then able to integrate these relationships into the way that we research and practice medicine. Decolonizing psychedelics, holding space. So, how do we integrate? Integrating starts with the recognition that the medicine is inherent to the land, and respecting this relationship will ultimately foster our own relationship with the medicine and the land itself. Integrating this concept into the modern medicinal model will ultimately influence all aspects of psychedelic healing practice, beginning with the space.
And space, in a modern sense, is typically held in an office which inevitably carries a hierarchical atmosphere. In the modern psychedelic model, we can shift the paradigm of space by changing the nature of the relationship that is between the practitioner and the patient, where the relationship is reciprocal. The practitioner is present to facilitate the patient's own ability to heal themselves while also allowing the patient's learning to influence their own understanding of the subjective healing process. So, with this viewpoint, the nature of space is ultimately what is shifted, where healing is not limited to an office setting, but rather healing is evolving through the level of relationship development between the practitioner and the patient. This could facilitate the healing process to take place virtually anywhere, whether that's a walk through the woods or a yoga studio or even a place of worship. But the takeaway here is that we have the opportunity to expand our horizons through the way in which we hold space. And doing so would aid in dismantling the hierarchical dynamic that does exist within Western medicinal practices.
And so, just as like a quick disclaimer, the term practitioner here is an all-encompassing term for therapists and researchers. Decolonizing psychedelics, practitioners and relationship development. As with every profession in medicine, there's always a cohort of individuals who learn and evolve their understanding of the specific practice with each other. Psychedelic medicine is no different. Future psychedelic therapists, practitioners, and researchers first need to be familiar with the medicine by experiencing it for themselves and practicing it with each other. This doesn't just mean taking psychedelics. It entails understanding concepts such as vulnerability, empathy, and building relationships, not only with each other, but with the medicine itself. Among each group of potential licensed professionals, it is important that they practice these concepts through the psychedelic experience with one another before they practice with future patients. Ideally, this would be analogous to an aspect of clinical training as a requirement for licensure. With studying and administering psychedelic medicine, it is imperative that its origins are respected through personal experiences that facilitate relationships with the land, oneself, and those present to the space. The evolution of this patient-practitioner relationship, once psychedelic therapy is established, could potentially include the practitioner's psychedelic involvement with the patient. In decolonized framework, rooted in origin practice, this reflects the original purpose of psychedelic medicine as being a collectively transformative experience.
So, this idea that Lake brings up is actually a direct reflection of this ideology in Dr. Joseph Tefort's book that's called The Fellowship of the River, where he was learning under Shipibo shaman in Peru after medical school. He learned about the importance of everyone's involvement in the psychedelic experience, which includes the medicine provider. So, with the evolution of modern psychedelic therapy, this notion could potentially be implemented to further along therapeutic progression. So, we will start by introducing our proposed modern psychedelic model. Within this model, the idea of ritual encompasses one, the patient practitioner relationship, two, administration of the psychedelic experience and the patient's relationship with the medicine, and three, the integration of the healing process as a whole. So, what does this look like in a clinical setting? Well, first and foremost, diagnosis is a way to objectively communicate what a patient is experiencing in order to use prescription for subjective treatment. So, a psychotherapist can facilitate or prescribe a psychedelic therapy session by way of expanding their relationship with their patient. And this also applies to the way in which clinical trials are run. So, the field of psychedelic therapy and research is one of subjective nature that requires more integrative methodologies that honor the body, mind, and spirit with reverence for the land. In essence, our model is ever evolving through time to unlearn colonialism and promote equitable healing practices for all.
So, where we begin, ritualizing relationships. It all begins when a patient walks into the room. The practitioner who views the patient immediately recognizes someone who is capable of their own healing. This is the nature of the relationship paradigm as previously mentioned. From there, the practitioner begins cultivating a connection to the patient by listening to their experiences, their worldviews, and ultimately who they are, not just someone with a potential diagnosis. The goal is not to diagnose someone to treat them, but rather it is to foster the patient's ability to heal themselves without attributing the healing process to the practitioner. The time frame of this phase of the model is arbitrary and completely dependent on the patient's willingness to evolve their relationship with the application of the medicine itself. In addition, this piece of the model is applicable to all fields, including research, and all cases within the mental health profession. So from here on out, we will dive deeper into the application of this process specific to psychedelic therapy and research.
Ritualizing experience. In our current clinical trials and practices, we have seen a basic form of psychedelic therapy sessions. However, what we are highlighting today is the restrictive aspect of this basic form, that being the lack of opportunity for activity in a completely controlled setting. Simply put, our proposed model fully embodies the idea of client centered therapy, allowing freedom of space and motion through multiple opportunities for various activities. This is also completely based on the patient's preference for how to proceed with treatment. So, in general, our model calls attention to the space of nature as a constant rather than a confounding variable. Through nature's dynamic evolution, its resilience is what breathes life into us all constantly. And this is something to be realized through relationship development prior to psychedelic treatment to ensure transparency between the patient and practitioner with regard to the natural setting.
So, in our proposed model, psychotherapy does not just require patients to come off their current medications before treatment, but rather it ritualizes the body's cleansing process. Medication withdrawal symptoms are relative to the patient, and therefore it is important for practitioners to help guide the process through daily check-ins until more severe symptoms subside. Cleansing the body is also ritualized through diet. In ancestral practice, it is common to abstain from certain foods prior to the journey itself, depending on the type of medicine, to avoid any internal physical distractions. In addition, fasting in a modern sense would be utilized in order to slow the body's digestion of anything other than the medicine itself, incorporating a sense of synchronization between the mind, the body, and the spirit. Once the body has gone through the abstinent process and the practitioner and patient feel ready, the application of the medicine can begin.
So, diving into the actual concept of the application of medicine, in the space of the patient's choosing, both parties will recognize that there's energetic value in utilizing psychedelic medicines for healing purposes. The practitioner, in all forms, is an anchor to ground the patient. The modern psychedelic model goes beyond asking questions like, "What are you feeling?" More so, questioning could entail a deeper exploration into the ever evolving relationship that is developing between the patient, their practitioner, and the land itself. In this sense, we ritualize the journey by not only feeling, but also embodying the way the body feels within space and through motion. Colonial psychedelic practices reflect the restrictiveness of the body in closed space, which directly translates to uncomfortability of physical expression. And we can say that physical expression is therefore a gateway to energetic expression. So the freedom of space and motion can break down those boundaries, which will inevitably generate openness and realizing one's own healing potential.
So finally, ritualizing integration. The modern psychedelic model utilizes the integration process in a fully embodied, client-centered manner, where control is completely shifted from facilitator to patient. Integration in this sense is entirely relative to one's own experience. Therefore, everyone's integration process will be different. The position of the researcher within integration is not to explain the patient's psychedelic experience, nor are they meant to be omniscient when it comes to understanding the nature of the patient's subjective experience. The position of the facilitator is purely to listen and to pose questions meant to further propel the client into their perceived understandings. What this means is that the questions themselves are going to be relative, based on the patient's experience. Within this paradigm, there can be no pre-written questionnaire because it is an open-ended discussion. The goal of the facilitator is not to re-diagnose or even to cure, but rather to empower the patient's own healing process. Thus, the challenge is not to explain the experience to the patient. It is to be present and listen to what the patient has to say without expectation nor hierarchical input. This is the culmination of the equitable practitioner-patient relationship that we elaborated early on. The time frame on integration is relative to the patient. There cannot be a rigid time frame because no two experiences are the same. It is up to the absolute discretion of the patient to decide how many sessions they attend.
And moving forward, so the modern psychedelic model is one of the many ways that psychedelic progression can adopt this decolonized approach. The advantages of this specific design is that it works as a mediator to implement a paradigm shift from a colonized therapeutic structure to a more decentralized form. The way that this is accomplished is by recognizing and unlearning ingrained colonial tactics imposed by contemporary psychedelic models. Instead, this favors a conscious approach that is rooted in ritualizing the way in which we research and practice medicine. So that is all.
Yeah, thank you
Thank you
everyone
guys for
for listening.
listening. I have some references too if you're interested, but yeah, thank you.